Welcome to Channel Health and Alerts. Did you know a type of virus triggers most cases of cervical cancer? That's right. A large group of viruses known as the human papillomavirus, or HPV, is responsible for over 90% of cervical cancer cases worldwide. This cancer occurs when abnormal cells develop and spread in the cervix, the lower part of the uterus. What's unique about cervical cancer is that there are rarely any warning signs. As the cancer progresses, symptoms might include unusual vaginal discharge, vaginal bleeding between periods, bleeding after menopause, or bleeding or pain during sex. If one of the high-risk strains of HPV lingers in the body, it can cause abnormal cells and may give way to cancer cells. Once cancer appears, it tends to spread in the cervix and surrounding areas. Early detection is critical, and the PAP test is a proven method for this. A swab of the cervix can reveal abnormal cells, often before cancer appears. Bear in mind that you'll still need PAP tests after getting the HPV vaccine because it doesn't prevent all cervical cancers. Should test results show abnormality, and if abnormal cells are precancerous, they can then be removed or destroyed. Treatments are highly successful in preventing precancerous cells from developing into cancer. A diagnosis usually involves a biopsy, which is the removal of cervical tissue for examination in a lab. A pathologist will check the tissue sample for abnormal changes, precancerous cells, and cancer cells. Cervical cancer is divided into 4 stages. In stage 1, the cancer is beyond the lining of the cervix, but it's still only in your uterus. By stage 2, it has spread beyond your cervix and uterus, and can also spread to nearby tissues. A stage 3 tumor reaches the lower part of your vagina and may make it hard to pee. Stage 4, the most advanced, means the cancer has spread to other parts of the body, like nearby organs. Treatment options include surgery to remove any tissue that might contain cancer. For women with cervical cancer, often a combination of radiation and chemotherapy is used. Radiation therapy uses high-energy X-rays to kill cancer cells in a targeted area, while chemotherapy uses drugs to reach cancer wherever it is in the body. There is also targeted therapy that focuses on changes in cancer cells, and immunotherapy that unleashes your own immune system to spot and kill cancer cells. The odds of surviving cervical cancer are tied to how early it's found. About 2/3 of women overall will survive for at least 5 years after diagnosis. However, statistics don't predict how well an individual will respond to treatment. A vaccine is now available to help prevent diseases caused by 9 types of HPV, including cervical, vaginal, and vulvar cancers in females. This vaccine helps prevent 90% of cancers caused by HPV. They're most effective if you get the shots before you start having sex. Remember, always consult your doctor. Share this information to care for others. Do subscribe to our channel for more enlightening content. Thanks for tuning in.